It's your health, and as we get ready to gather for the holidays, coronavirus is still lingering along with typical illnesses that start circulating this time of year. Dr. Gabe Schifman with Overland Park Regional Medical Center is here to talk about some of those illnesses and tips to keep kids healthy during this time. Good afternoon, Dr. Schifman.
Hi there.
So first question, 'tis the season for kids to catch colds, right? So what is the difference between a cold and pneumonia?
So they're both infectious processes. It just kind of depends on where the virus or bacteria settles. Colds are more upper respiratory in nature, so your nose, your throat, your sinuses, kind of above the neckline. These can present with fever, tickle in the throat, a sore throat, sneezing. And then the lower respiratory illness, which is the pneumonia, that's the one that settles into your lungs. So it could present the same way initially with cough, fever, body aches, but then you have that difficulty breathing, that kind of pain in the chest. Those are a little bit more concerning than the colds themselves.
We know flu is also something that's big this time of year. What's the best way to protect kids from that?
So any kid 6 months and older who has not gotten their flu vaccine needs to get it right now. You can still get it right now. That is the best way to protect yourself from the influenza virus this coming season.
And how can parents tell the difference between flu and appendicitis?
Well, the difference between those two is flu or influenza is an infectious process and appendicitis is not. So an appendicitis is an acquired occurrence that happens out of just luck or bad luck, but they can present the same way. So both will present with fever, some body aches, and vomiting. But with the appendicitis, usually that pain migrates to the right lower quadrant, just above your hip bone on the right side, and that pain gets worse and worse and worse. If anyone has fever, vomiting, and right lower quadrant pain, that is a medical emergency. They do need to go see a physician in the emergency department or your doctor as soon as possible.
Okay, so RSV, another thing that we see during this time of year. What are the signs and symptoms of it?
So RSV, or respiratory syncytial virus, is another type of viral illness that we see during the fall season into the winter. It usually affects the youngest population, so a few weeks of age up to about 2 or 3 years of age. We all can get RSV, but it usually wreaks more havoc on the youngest population. Signs and symptoms for that would be, again, fever, congestion, cough, sneezing. But with the youngest, the most impressive part of it is that they have difficulty breathing. So they'll have increased work of breathing, they'll be breathing faster, and this could also be a medical emergency. So if your child is having difficulty breathing, definitely go to the emergency department for that.
Okay, this is a lot to take in. I hope people at home are kind of taking notes. Some of these symptoms, they mimic one another. So what else can parents do to actually keep their kids healthy this year?
Well, we've kind of been used to doing all the right precautionary measures with COVID-19 going on right now. So keeping distance if you have any kind of symptoms with cough, fever, congestion, runny nose, washing your hands, wearing masks, all the normal stuff that we've been doing to prevent illnesses spreading during COVID. Same thing with the other viruses that are out there as well.
Okay, perfect. Thank you so much. Always bringing the great information, Dr. Schifman. For more stories just like this, head over to our website, kctv5.com/HCA Midwest.